So hi everyone, as Shoba said, I'm Jennifer Forsyth, I'm Policy and Evidence Manager at Obesity Action Scotland, and I would also just like to extend my thanks to you all today for being here and to welcome you to the conference. I'll now move on to introduce the chair of the first session of the conference, which is looking at food promotions and inequalities in obesity. The first session is being chaired by Michelle Wilson, who is Head of Children's Services at Children's Health Scotland, who are an active member of the Scottish Obesity Alliance. So with over 30 years in the NHS and the third sector, Michelle is driven by a passion for improving children's health and wellbeing. As Head of Children's Services at Children's Health Scotland, who are the leading children's health rights charity in Scotland, she works closely with children, families and carers and professionals to champion every child's right to the best possible healthcare. Children's Health Scotland advocates for the healthcare rights of children and young people, providing vital resources, guidance and support to ensure they receive the care they deserve. So I'll now pass you over to Michelle, who will take you through the rest of the session. Thank you.
Hello everybody. Can everybody hear me okay? Yeah, good. So I'm going to take you through the kind of structure of today. We have got 4 speakers. I will introduce them each just before they speak. They're going to have around 12 minutes, but we won't take any questions until after all 4 speakers have spoken. Now, our next speaker is Alana McDonald from the Food Standards Scotland, and her topic is data and evidence on food promotions in Scotland. So can we welcome Alana? Thank you.
Okay, thank you very much and good morning. Thanks for having me here today at what's going to be a really interesting and thought-provoking session on food promotions and inequalities. My name is Alana McDonald and I'm a Senior Public Health Nutrition Advisor at Food Standards Scotland. And I've worked on lots of different areas during my time at FSS, including dietary monitoring and our work with the Scottish Government around proposals for the restriction of promotions of unhealthy foods. Normally, I would say a little bit about the remit of FSS, but since I'm short on time, I shall just briefly say that we are unique in that we have a statutory responsibility to improve the extent to which diets are conducive to good health, and that as a science and evidence-based organisation, our role is to use our expertise, influence and data to work with partners and drive preventative measures to improve the Scottish diet. So starting off with a bit of scene setting, adding to what Dion has already outlined around diet and its importance to health. On a global level, poor diet accounted for 10.6% of all deaths in 2021, with cardiovascular disease being the leading cause of death associated with diet. And in fact, the Global Burden of Disease study, where this information is taken from, outlined that 3 of the top 15 risk factors are associated with poor diet, including high sodium intakes, low fruit and veg, and low whole grain intakes. And we see a similar picture, sadly, in Scotland, with data from the British Heart Foundation finding that 28% of deaths in Scotland, or 50 people each day, are as a result of heart or circulatory diseases, again, with diet being a significant risk factor. So moving on then to provide an overview of our diet in Scotland. So firstly, looking at progress towards the Scottish dietary goals, we see pictured on the slide a summary of progress amongst adults, with the average for all adults being shown in the dark blue, and then differences for men and women in the lighter coloured bars. And we can see that for all the goals pictured that progress is pretty poor. And the worst example there is fibre, where just 6% of adults meet the recommendation of 30 grams per day. Energy density, saturated fat-free sugars also pretty low, between 20 and 26% of adults meeting that recommendation, and quite similar between men and women. A key issue in our diet and for progress towards the goals is our intakes of discretionary foods, and these are things like cakes, biscuits, confectionery, crisps, sugary drinks, so high in fat, salt and sugar, and not particularly needed for a healthy balanced diet. And we've found through our analysis of the Scottish Health Survey that these foods account for around 15% of our energy intakes, 18% of saturated fat and 38% of free sugars. And inequalities are rife within our diet, sadly, and those in the most deprived areas consuming lower amounts of fruit and veg, fibre and oily fish, but more red and red processed meat and sugary drinks than those in the least deprived areas. So, digging a little deeper into the diets of children and young people and showing some of our recently published DISH survey findings, which looked at diets of 2 to 15 years old in 2024. In general, and probably not a huge surprise, that the findings demonstrate again that poor dietary intakes are a challenge within these age groups, particularly for those aged 11 to 15 years old. And in terms of adherence to the Scottish dietary goals, you can see in the slide that the numbers again are quite low, and in some cases lower than even than compared to the adult data. Fibre, again, another quite shocking example, just 16% of children overall meeting the fibre recommendations, and you can see again there's quite a significant issue with age, where much fewer children in the 11 to 15-year-old age group consume the recommendations compared to the 2 to 4 years old. And again, we looked at these discretionary products, and as we've seen for adults, a considerable proportion of energy and free sugars is coming from these discretionary foods, and both of these figures are higher than the equivalents for adults. Building on the earlier point around inequalities, the survey also demonstrates key differences in the diets of children by area deprivation. So the example given on the slide here is fruit and veg, where that difference is almost 80 grams, so the equivalent of a full-sized adult portion. And again, we found that children living in the most deprived areas had lower intakes of fibre and higher consumption of sugary drinks, which is echoed within our findings for adults. So this is the final slide on children, and firstly to raise, although there's quite a great emphasis placed on protein, particularly in recent years, we didn't find any evidence of low protein intakes among children and young people, and actually in some cases intakes were over 300% higher than the maximum amount recommended. For most vitamins, intakes were also generally adequate across the age groups. However, for many minerals, as you can see on the slide, intakes were often too low, particularly in that older age group of 11 to 15-year-olds. And a few particularly concerning findings drawn out on the slide where intakes were even lower than the lower reference nutrient intake, which is the lower amount that is only sufficient for 2.5% of the population. So you can see that in the case of iron, 43% of young girls were below even this amount. So moving on then to the solution to this, and that is the food environment. So the commercial determinants of health have a significant impact on our health, and these are activities that influence the social, physical and cultural environments, for example, supply chains, labour conditions, product design, research funding and so on. There are inequalities around this, and whilst commercial determinants of health affect everyone, young people are especially at risk, and unhealthy commodities tend to worsen pre-existing economic, social and racial inequities. The food environment in which we live makes it incredibly difficult for individuals to make healthy choices. High-fat, salt and sugar foods are often heavily promoted, advertised and marketing far more so than healthier options. And we know that these issues are felt often more deeply in areas of deprivation or in light of cost of living pressures, which can put healthier options out of reach for many. Ultimately, as Dion has said, what surrounds us shapes us, and there's a need to move away from this individual focus problem and instead change the food system, and that includes all of it, from retail shops, cafes, restaurants, travel, vending and so on, and includes the wider influences such as marketing, advertising and promotions, which impact us all, whether we realise it or not. So one really important measure that we can take, and we welcome the Scottish Government commitment to, is action on the promotion of high-fat, salt and sugar foods. Promotions can be really influential in our decisions of what to buy, when to buy it and how much to buy. And when it comes to food, they can encourage us to buy 18% more than what we were originally intending. And our latest estimations from Kantar suggest that as much as 20% of the food that we buy from shops and supermarkets is done so using a price promotion. And that includes things like 20% off, 2 for £3, buy one, get one free, and so on. And you can see on the graph that the majority of our purchase on price promotion is through these temporary price reductions, and that's remained quite stable for a number of years. So, exploring the promotion of different food and drink categories now, the wee box has gone a bit ski-whiff. The chart shows the proportion of some of the healthier categories purchased on price promotion on 2022, alongside the total discretionary foods and the additional categories that are those included for consideration within the Scottish Government proposals. So we found that just over 28% of the discretionary foods and almost 30% of all these additional categories were purchased on price promotion in 2022. And both of those were purchased at a higher level on promotion than the overall average for total food and drink. And looking at the discretionary foods in more detail, we can see that of these individual categories, ice cream and edible ices were had the highest volume purchased on price promotion at 34%, and sweet biscuits had the least at 24%. But as before, all of these are still above the overall average for total food and drink. And whilst I've not included a slide on those additional categories for reasons of time, we do see a similar picture again, and that includes things like ready meals, pizzas, breakfast cereals and chips, many of which are high in fat, salt and sugar. So this is my last slide. I've largely today focused on price promotions in relation to the retail environment, and modelling by Scotland's Rural College, commissioned by the Scottish Government, found that restricting all price promotions of discretionary foods alone could reduce calorie intakes by as much as 613 calories per week. However, we know that there are many other types of promotions as well. There's everyday low pricing schemes, loyalty card pricing, location-based promotions as well. And we know that these are not tactics solely used by the retail industry. We see these promotions within out-of-home sector too, and within online, including digital ordering platforms. And as we see with the data from the retail environment, they're often used to more actively promote the high-fat, salt and sugar foods over the healthier. Promotional restrictions therefore need to capture as wide a range of promotional types as possible, applying to as many settings and as many categories of HFSS foods and drinks as possible as well. And doing this will ensure the strongest basis for a reduction in health harms as a result of this policy, for which a robust monitoring and evaluation strategy will be essential. Thank you very much. Looking forward to the discussion.
That was wonderful. Again, you stuck brilliantly to time, and it was just fascinating to see the statistics on how much we are encouraged to increase our spend on promotional items. 18% really quite surprised me, and the amount of sugars that young children are getting from discretionary sugars, discretionary foods and the sugars. It was just, yeah, thank you very much, very interesting. Look forward to the questions at the end. Everything working again properly. So our fourth speaker of the day is Dr. Shoba John from Obesity Action Scotland. Yes, okay, we're good. So we obviously had Dr. Shoba John introduce us at the start, and she is going to come and do what would have been our final speaker session, and she's going to talk about the parental perceptions of food promotions in retail settings in Scotland, which I suppose sits very nicely with our last two topics. So if we could welcome Dr. Shoba John.
Good morning again. I'm here to bring to us work done by the team at OAS, along with colleagues at Fast Forward and Connect, on a research that we were trying to do to look at what we heard from data from Dion and Alana looks like for real-life people. So one of the key policies that Scottish Obesity Alliance and Obesity Action Scotland is advocating quite a bit this season, particularly, is around regulation of promotions of high-fat, salt, sugar food, which the Minister alluded could be coming up any time. So we are waiting with bated breath for that to come up. But to inform that policy decision, we thought it would be useful to see what would these promotions mean, particularly for parents from low-income backgrounds. So that's a research that this was just done last month. So it's a copy of the report would be in your brown bags again. So feel free to look at that at leisure. Okay, so what we did was to conduct a focus group research with 2 groups of parents, of 9 parents each, of 4 to 16-year-olds from different parts of Scotland in the month of April. Again, there's a QR code here in case you want to access this report online later on. So the 2 focus groups of parents, one was of single fathers in person, and the other of mothers and fathers, that was conducted online. And 71% of those who reported their demographic details, the parents earn under £20,000 annually, and only 35% worked full-time and are educated above level 3. So really, mostly the sample was of parents who were from low-income background. In terms of top results, we asked the parents about what their experience of daily food shopping is like, and that gave us quite an insights about the food environment in which they move around, and we all move around in some ways, but particularly of relevance in their context. So one of the key themes that emerged from that conversation was that the food environment is dominated by supermarket chains. And we were surprised that none of the parents mentioned a local grocer or a convenience store as a place where they get their daily food needs from. So that's surprising in terms of the monopoly, as one of the participants said, of the big supermarket chains of the food environment. And one of the parents said we had allotments and farms in the past where you could go get local produce that was cheap, but now it's massive supermarkets that took away the local little bits. Another key theme that emerged from it, and this was very strong across participants, was about the high cost of healthy food that is limiting their choices. And lastly, children, not surprisingly, seems to be a great influence on what parents buy when they do food shopping, and that's experience for all of us as well. But interestingly, many of them said that the children's choices are in turn influenced by the brands that they are exposed to. As one of the parents said, you're paying for the brand, like bottles of a particular sport drink brand. Everyone wants to buy it because it's a thing. You have to buy your kid that because you don't want them to be less popular. So the peer pressure that all of us grew up through is very real as for parents to experience it from their children. We did ask them about the price promotions and as well as placement promotions within stores. And the study was all about promotions within retail stores. So about price promotions, interestingly, we observed that the participants observed that it's predominantly the promotions are on unhealthy food. Very few times they would find price promotions or reductions on healthier options. Secondly, the responses of the participants, when we analysed, seem to be driven by an underlying factor in terms of food affordability. If a food is affordable, that's what they would want to buy. And so that is the price factor plays a critical role in terms of what families buy. We tried to look at some of the underlying triggers of price promotions that is making parents to buy unhealthy food purchases. And here's a thematic mapping. Not sure whether you can see it, but the report has very good print, so please feel free to refer to that later on. So the price promotion that the companies are producing seems to be leveraging affordability, pitching on availability of unhealthy food, as well as psychological influences. And that's a term that came frequently from the participants. For instance, one of them said, if you look at a lot of buy one, get one free, they raise the price of that product by, I don't know, 30%, whatever, and then they give you a buy one, get one free. So they're always making profit, all these half prices. So customers do see through them, but they're still an attractive proposal for them because the healthier food is not as affordable as the unhealthier food, which is on promotion. The brand appeal is another thing which many participants said they thought the promotions are trying to build, not just for children, but even for them. And the participants saw through the strategy behind the promotions, and they thought that it's primarily aimed at getting them hooked on specific products so that they'll go back to buy again. Just two examples of price promotions to dive a little deeper. One is of multi-buys. So this was the most commonly cited promotion in the research that most parents thought multi-buys. They when they were asked about what's the kind of promotions that you have experience of, they would say multi-buys, and they perceived the multi-buys to stimulate compulsive buying. And like one of the parents said, I could go in and buy maybe an extra 10 items that I wasn't planning on getting if I thought I was getting a good deal. So, but bear in mind, these are families from low-income backgrounds, and therefore that unplanned expenditure has implications in terms of what it might be displacing from their other basic necessities. Last but not the least, not only compulsive buying, it's unplanned expenses, so the budget gets constrained. Similarly, we're looking at temporary price reductions, which is another form of promotion that the participants mentioned. And some of the parents thought it's actually a relief on their limited food budget, but they remarked that these are rarely on healthy food, which they would have liked it to be, but that's not the case. Then we asked the participants about their experience of the placement-based promotions. These are within stores. Where are the promotions that they have experienced? And most of the participants spoke about store entrances, checkouts, and islands, which are strategically chosen to display unhealthy snacks. And some parents reported this triggering compulsive buying for themselves. And so one of the parents said, I have to just, buy because it's just there in front of me. And I could just see it. And it actually seems like it's calling to you. So that's the kind of influence of placement promotions. And the positioning was perceived by some to be deliberate to hook consumers, as I mentioned before. Like with the price promotions, we could see a similar strategy that the participants identified in terms of the placement of these products. So they thought that this is not just accidental, but it's by design that the unhealthy products and the promotions are at specific parts of the stores. One interesting they spoke about was about seasonal promotions, particularly around Christmas, Easter, those seasons. All the promotions tend to be on unhealthy food and rarely on healthy options. Child-targeted placements. This many parents particularly found it problematic. Products placed at children's eye level, and these promotions were designed to capture children's attention and made shopping with children more difficult, understandably. And one of the parents put it this way: it puts a tremendous pressure on parents who don't have the money, and these things are strategically there to get the parents say, okay, go on, we'll buy it for you. So that's the sort of sense of helplessness that many parents expressed. We asked them what they would like to see as a response to the influence of these promotions. And most thought government had a role in policy making, and that bold and urgent action is desired, and policies to promote and incentivize healthier food alongside curbs on unhealthy food and its promotions was suggested. One of the participants said, act now, don't wait 10 years, or study data, consultations and the likes. There are things that can be done now. So sense of urgency that they expected from policymakers. Summarizing the key findings, the participants were almost unanimously asking in terms of healthy food to be made affordable, and currently it's unaffordable, and therefore a driver for seeking unhealthy options on promotions. And secondly, in terms of impact of price promotions, these are mostly on unhealthy food, influence impulse buying and unplanned spends, builds brand loyalty, and often leads to wasteful expenses. Placement-based promotions, the supermarket layouts and promotion placements at checkouts and aisles, they are also encouraging compulsive buying according to these patterns, with unhealthy food dominating the space. One of the participants said, you rarely see vegetables at the entrance of a supermarket. They're always hidden in the shady areas of the store where light is dim and you really need to look deeper to locate your vegetables. Implications for inequalities. The perceived value of cost saving that these parents thought the promotions are offering, and the unplanned expenditure practically means a disproportionate impact on the low-income household budgets. And policy suggestions, as I mentioned before, they call for very strong and early action in terms of both incentivizing healthy options as well as restricting the unhealthy promotions. Based on these, what would a policy framework in response to this research findings look like? What would be the key components of any legislative and policy measures need to include? So, for instance, any legislative measure needs to be comprehensive, including and ensuring healthy food is made affordable and available, and it is actively promoted. And particularly the promotion of healthy food is a theme that many parents said. It's not just that it needs to be available, but we know where it's available, and it is promoted and stimulated in a nicer way that it's as attractive as the promotions on unhealthy food. And then restrict unhealthy food and their promotions. Introduce mandatory targets for healthy food and their promotions. There's been some encouraging news this week with Tesco calling for some mandatory targets. Let's see where that leads us in terms of whether that would stimulate policy measures, whether that would boost the government's commitment to introduce mandatory targets by legislation. Inform families regarding healthy, affordable meals. That many people thought they didn't know how to cook healthier meals. So there's some role for that kind of education. Resource supply of healthy food from levies on unhealthy food and drinks. Many people thought you should levy soft drinks and other things, take the money and then make healthier options affordable for those who cannot afford it otherwise. And lastly, to adopt coherent regulatory approach across health-harming products. Some of the participants asked us questions. Why is it that if you can do this on tobacco, why can't you do it on unhealthy food? Or there are regulations on promotion of alcohol, but not on unhealthy food. So those are some of the top-line results. I'm happy to respond to any questions later on.
Thank you very much. great. That was fascinating to hear what families themselves observed, thought and felt, you know, and it backed up everything that we've heard so far today. So that was very interesting. Thank you very much. I am hoping we have technical difficulties sorted. Yes, we do. So that's lovely. We will now go to our virtual speaker. Well, she's not virtual. She is real. She's just joining us virtually. Professor Christina Vogel, the Director for the Centre for Food Policy and the Professor for Food Policy at St George's University, London. And I'm hoping she's... Yes, I can see her on the screen. So.
I'm delighted to be joining you virtually. Thank you very much for the invitation and for giving me the opportunity to talk about a topic that I am very passionate about. And I hope that you'll enjoy the sort of short presentation that I've got today, really talking about what we've learned so far from implementation of the Food Promotion and Placement Regulations in England. As Michelle said, I am Director of the Centre for Food Policy, and our vision at the Centre is really to inform policy and practice so that we can redesign our food systems so that they are healthy, environmentally sustainable, fair, and also resilient. And we do this through a range of activities. One of those activities is our research projects, and really that's what I'll be speaking to today. But we very much take a systems approach, and you'll see that in the results of the work that I'll be presenting today. And we think that partnership and lived experience is so important. So Shoba, it was really lovely to hear about the lived experience work that you've been doing and hear those results. So just a quick reminder for anyone in the room that isn't familiar with the current regulations in England. The Food Promotions and Placement Regulations were passed in law at the end of 2021 in England and came into effect in October 2022. And this graphical image is a really lovely image that comes from the Association of Convenience Stores. And actually, that's my first lesson, is that actually the detailed guidance that was produced by the government, while it's been very useful and very much appreciated, actually there's needed to be a more interpretable, easy to understand version for a wider audience, and particularly for smaller store owners. So this has been really, really welcomed, but across the industry really, and for a whole range of different stakeholders and players. But largely the businesses that are in scope have more than 50 employees. They're stores that have a square footage, and this is a sales area of more than 2,000 square feet. And it applies to both in-store and online retailers. So the in-scope locations, there's 3 in-scope locations. The front of store, so the 5% of the surface area, sales surface area is in scope. End of aisles, and this is 50 centimetres around each end of aisle, and it's every end of aisle in the store. And then 2 metres around the sales area at the checkout. The products that are in scope are HFSS. There's 13 different categories that are in scope. And then it is enforced at the local level, so enforced by local authorities. So what's the research that we have done to date? The work that we have done really was a pre-implementation evaluation. So we wanted to understand what people were doing in preparation of this legislation coming in. So all these data were collected before October 2022. We took a systems approach so that we spoke to over 100 different stakeholder groups across the sectors. So health, citizens, businesses and enforcement agencies. Businesses included a whole range of businesses, small retailers, large retailers, manufacturers, and some wholesalers. And really, we used rapid qualitative methods. So you were able to speak to a lot of people and hear a lot of views, and you do a quick and rapid analysis of what you hear. And what we really did, which was very important, was a validation and prioritization stage. So we held an online conference because people were really interested in this work. And again, I think this is a great learning. We had some really good feedback from this particular conference. We had a range of speakers, and a lot of people were able to join, and the conference was recorded. It was just a half-day conference, and it was really well received. It was useful for us because it allowed us to validate our results and also prioritise the recommendations that came out of the work. So what did we find from this work, bearing in mind that this was done before implementation of the regulation? And what we found really is that across the different stakeholder groups, across the board, everyone felt that the legislation was a good first step. But that first step is a really important component. So everyone was behind it, but they had some concerns. And for some people, there was a real concern about exploitation of loopholes. And again, it's really great to see that some of these loopholes have been considered and have been addressed in the guidance that came out, or the proposal that came out from government, of which we're waiting for their response to. But particularly they were worried that things like alcohol, which is exempt, and tobacco products would be used at a large scale and other exploitations of loopholes, such as bin drops and in-aisle bin displays, which again is one of the things that's been addressed in the current proposed regulation. There was also a real concern that exemptions may increase inequalities, and we've heard a lot about inequalities already this morning. And there was a real concern about nothing happening, and that the small convenience stores, of which children might use, older adults might use, and that, families who have less access to transport might be more dependent on these stores, that actually might have a less healthy sales offering. The other two components that came up was around the complex issues, recognition that really obesity is complex, and some manufacturers and retailers really felt like, why is out of home not included? So again, it's excellent that the Scottish proposed regulation has included out of home as part of this regulation. And my personal feeling is that's a really important step, and I think it's likely to have a bigger impact. The other thing that we've heard a bit about this morning is the rebalancing the cost of food. So there were real concerns that that healthy food is so much more expensive per calorie than unhealthy food, and that further action is needed around that, and that maybe just the multi-buy promotions isn't going far enough, and we haven't even had them implemented yet. So they're due to come in October this year. The second sort of key findings that we found was that there was a fear around inconsistency in approaches that could affect impact, and we're seeing this really unfold. So particularly the complexity of the regulations. So for enforcement, so we had enforcement officers tell us, and still tell us, that this is a really complex kind of legislation. There's complexity in measuring square footage, there's complexity in measuring the distance from the end of aisle, there's complexity in kind of measuring the 2-meter radius around the checkouts. So this complexity actually makes it harder to enforce, but it also makes it harder to implement. And if you think about implementation, you can have lovely planograms come from head office, but implementation actually happens at the store level. And so what level of training is being rolled out across stores, and so that complexity is really understood by a wide range of people who are responsible for implementing or enforcing these regulations. There was also a real concern about limited resources. So it's been fine for the big retailers, but some of the smaller retailers, the discount variety stores, who may have fewer resources and not be able to properly understand the legislation, or necessarily have the resources to give the investment, where you might need new end of aisles, new displays for, and that all requires investment and additional resources. So those limited resources really then link back to that fear of potentially increasing inequalities. There was also this real fear that we hear a lot about, sort of a postcode lottery or priorities of businesses, where some may see that there's an opportunity for potential market differentiation by really pushing more of the healthy products that are non-HFS. But there was similarly a fear that actually those that are sorts of businesses that are more commonly used by families with lower socioeconomic status, that actually they might be exploited a bit more, and therefore be less likely to sort of promote and publish and push on health. So there was a concern around that, and also around enforcement of the regulations, that might be less prioritised in some areas over others. So what did we see when the regulations came into effect? Well, on the left here of this slide is some excellent images. This is exactly what we want to see when we walk into the store. We see loads of water and pumpkins. It obviously came in October. What we want to see is lots of non-food products on the end of aisle, so limiting that chance for impulse purchasing. So we did see these things in October, November 2022. But by December 2022, you're starting to see more of what you can see on the right-hand side. So these images where this is a fruit and vegetable section, and there's HFSS products smack bang in the middle using these in-aisle displays, these box drops that are out of scope of our legislation in England. This one is fascinating. This is a Tesco. This is a large Tesco, and what you have here is the first aisle. The width of the first aisle has been expanded, and so you now have this fake first aisle, which allows large amounts of Christmas confectionery to be sold at scale and en masse. So to some extent, this could be an unintended consequence where actually we might be making things worse than they were before. And also there's plenty of alcohol now at sort of front of stores, so that exploitation of loopholes. But this is still largely compliant. And in Scotland, if you're able to overcome some of these loopholes and tighten up the regulation, it would be excellent, and hopefully allow England to follow suit in due course. So where are we in terms of impact? Oh, sorry. There hasn't been much evaluation to date. There's lots of evaluation going on, and I'll talk a little bit about those at the end. But what we have seen published is sort of this early work that was done by Kantar, who looked at their sales, and really which this shows is that there was a lot of reformulation. So it's really been a big push in reformulation. Nomad Foods really have led reformulation in pizzas. And what you can see here is that there was sort of 51% of pizzas at the time, sort of in 2022, before the regulations, were HFSS, and that has been reduced to 42%, and this was in 2023, so there will be much further reduction. Nomad Foods pledged that by the end of 2024, all of their pizza products would be non-HFSS. So, we know that this reformulation has continued to unfold in sort of obvious categories. The other obvious category is crisps. So again, we've seen in crisps that there has been a reduction in the number of HFSS products that are available on sale. So we can see here that it was just over 4% in 2022, and then in 2023 that had more than doubled to 11%. And again, Doritos outlined that all or most of their crisps are now non-HFSS. So there's been a lot of reformulation of products in this area. The other thing that this very early evaluation showed, so it was 6 months after the regulation was implemented, it showed that there had been a reduction in confectionery sales of around 4 to 5%. Now, we don't know whether that continued, but that in itself looked quite good. However, there are real concerns that that trend might continue because of increasing lack of compliance. So these are some photos that I have taken whilst I'm out shopping. These ones have actually been taken this month. So in June, I took these two pictures. This one is from Easter, where this is chocolate at the checkout. I mean, this is entirely not allowed, but we're seeing it. And what we're seeing here is that my interpretation of what's happening here is that head office are showing a planogram that is highly compliant. So you've got all non-HFSS products at the end of aisle, but you've got this Cadbury's display of chocolate very, very close to the end of aisle. And this is within that 50 centimetres. And you're also seeing Red Bull, full sugar Red Bull at the checkout. So, you're seeing very strong instances of non-compliance. Now, why is this? Really, when we've spoken to enforcement officers, there's two key reasons. One is there's not enough money. Two is it's a new complex regulation. So there is a lot of complexity. How do you know which products are HFSS? How do you know if they've been reformulated? And this quote here is really lovely. It says, you know, how many bargain buckets do you need in a row to constitute an aisle? And, you know, how do I know that, is it just one infringement or is it 6 infringements within, you know, if you're thinking about a supermarket that's got 48 end of aisles, how many times do they need to be showing HFSS for it to be non-compliant? And the other thing is that the whole fine process is very complex, and the fines are not a deterrent at all for these very big companies. They're only a couple of £1,000 and they're really not strong enough. They're not enough of a stick for companies to worry, but they're also too much of a hassle for local authorities. In terms of funding, this is a really big learning for Scotland. There just hasn't been enough money to support enforcement by local authorities, and it hasn't been ring-fenced. So FOI requests showed that there was under £180,000 across 317 local authorities that was distributed for enforcement in the first year, and then that was just over 100,000 for the second year. So this is completely insufficient funding for local authorities that are already strapped for cash. This picture here for me is, I think this is an area that requires much, much more research, and I'm very excited about how we might do this and how we might have more of a polluter pays approach. So something more along the lines of should the mandatory reporting be come out and you have businesses that are not meeting the targets that they're set for mandatory reporting, then maybe they pay an additional fine and that gets ring-fenced and sent straight for enforcement of HFSS regulations. But I think, as I said, we need to do much more thinking around this. Just a bit of evidence to wind up. Yep. Yeah, sure. Just to say, we don't know much around the price promotions. What we do know is that the temporary price promotions have the biggest impact. And there's some really good evidence, I've got these in the bottom of the slide here, to show that that's from systematic reviews and modelling evidence to show that it really is a temporary price reduction. So again, it's excellent that that's in Scotland. So the last thing to just do as a takeaway is these are the recommendations. It's all in our publication in BMC Medicine. And really the big thing is about ring fencing funding for enforcement. But also I believe that we've moved on from this need for a HFSS calculator, though I think it should still be available, and really the need for HFSS labelling that would make it clearer to consumers, it would make it clearer to enforcement officers, and it would make it much more likely for that we would actually get adherence and compliance. The last thing is, I think that we're undertaking a trial which has some evidence, some moderate evidence for coupling this regulation with a requirement to promote healthy. And actually, I think we could push further around that. So let's say that within that 5% of the store surface area at the entrance, we require stores to have fruit and vegetables for sale if they're greater than 3,000 square feet or something like that. So I think that there's more that we could do around coupling the removal or restrictions around HFSS alongside the promoting the healthy foods, particularly fruit and vegetables and other minimally processed foods. The only other thing I just wanted to end with here is this is a picture. This is all HFS, like non-HFSS ice cream. And these are the kind of displays that we're seeing. So industry are constantly ahead of the game. And really that comes to the need for refinement. And actually, if Scotland could put into the regulation that it would be reviewed and refined at least every 5 years, that would be excellent, because you would keep pushing industry and keep pushing the boundaries around that. And then there's just sort of 3 different studies that I wanted to highlight around ongoing evaluation of these regulations. Thank you.
Thank you very much. Now we, because of our technical difficulties, we are running slightly behind on time, but I think we still have our full 10 minutes for question and answer session. Does anybody have any questions for any of our 4 speakers? And we have a microphone there at this side. If you just want to, I don't know, wave or indicate that you might possibly have a question, that would be lovely. I have a question over here.
Can I ask, where do food banks feature in all the design? at the moment? And the other thing is there any consideration to the kind of current trend of having all the food delivered at will, which is probably in the main not particularly healthy?
Could I just ask you to repeat the first part of your question again? I caught the second part about food delivery and how easily it is to have just anything delivered now, but I didn't quite catch the first part of your question.
The food banks?
Food banks.
Food banks are obviously very especially for people on low incomes or low incomes. And I haven't seen any mention of them.
Okay. They are kind of two quite separate questions. Will we go with food banks first and then on to food delivery, if that's okay? Would anybody like to discuss food banks?
The second one again.
You would do the second one. I would just like to ask a question for Christina. Were food banks covered in the legislation in England?
I'm sorry, I'm afraid I can't hear you very well. Might that be repeated?
Hello. One of our questions from the audience was about, I guess, the quality of food in food banks, and it can be very variable, and we often do see items that are HFSS, but we do also see some fruit and vegetables as well, and we were wondering if it was covered in the legislation in England, or was it purely retail? I don't quite know where food banks sit in England, so we were just curious.
Yeah, I would think that food banks would be considered a charity, so they're not included. It is retail outlets, and it is food and non-food. So say Primark or Next or M&S are included, even though they don't necessarily traditionally sell food. But I don't believe that charities aren't included. So food banks would be considered a charity, and social supermarkets potentially a social enterprise. So they'd also be exempt.
Reliance on food banks within Scotland, and they have a projection to 2030 to enable us to be, as a nation, less reliant on food banks. We see a lot of work going on in food banks, changing their kind of status of just purely being a food bank and trying to offer more community-based supports as well. They work incredibly hard to make sure that they can offer good quality, healthy, nutritious foods. Again, sometimes they're very reliant on donations, and we're hoping to move on the whole to a more dignified money-based system rather than food banks. And I think if we do that, then obviously if we're listening to what's kind of gone on in England and we're thinking about the legislation here, then it is worth considering that as well. And then the second part was about food delivery. So I will open that up to our panel. Yeah.
Sure. So our research was focused on retail stores, but our participants did refer to online delivery being more problematic for them, because then they don't have to even go to a store. And so if you have a multi-buy deal that's going on, it's online, just click, and so that they found it much more compulsive in terms of persuading them to buy, because there was less effort physically that they required to put in to get it, and therefore more money going out of their pockets. So that was the reference in our research. We did not look at online retailing because that was much more difficult to execute, and our focus was particularly on retail stores. The next session, actually, we have a speaker from Scottish Pantry Network here, Mandy Morgan, might speak to the food bank part, perhaps in the discussion there.
Can
Can I, sorry, just to add, a really important point on the out-of-home sector, so the food delivery, cafes, restaurants, it's really, really important that we do consider that. So we know that calories coming from there is around 25% of our diet, so it's definitely important that we don't forget that. And as you've rightly pointed out, a lot of the food that's delivered and accessible is less healthy, high fat, salt and sugar. I think just to highlight the work that's ongoing within Scottish Government, Public Health Scotland and FSS as well, to develop an action plan to make it easier for businesses to offer those healthier options and kind of look at things like marketing practices as well. So yeah, just a really important point that you raised. Thanks.
Thank you very much. We've got a question at the front.
Thank you. I think this is probably to Christina. Mary Brennan from University of Edinburgh Business School, but anyone else on the panel. I'm a little cautious around how responsive the industry, in particular big food, have been to reformulation as a result of the English regulations, and I'm wondering whether you have some reflections on the role of reformulation, because it's gaining traction in a Scottish food and drink context. It's being seen as a part of or a big part of the solution, but I have some growing concerns that it's a sort of race to a set of criteria that then gets one into one category and out of another.
Thank you so much. I completely agree. There's two points I would say to that. One is actually, I think that's a good thing for clarity. So at the moment, we have so many different definitions of what unhealthy means that we need one that will target investment and understanding and comprehension is sort of a level of clarity for consumers. Coupled with that, however, we have to continue to push industry. So the downside and the sadness from my perspective is that we have a 2018 nutrient profile model that is ready to go, that is actually more closely aligned with our current dietary guidelines around increasing fibre requirements and reducing sugar. And that really is what we need to be doing, is to continually refining and updating that nutrient profile model. And in the future, it might be that we don't include artificial sweeteners, or there's sort of emulsifiers or elements of processing that is dependent on the evidence and that evidence base. So I think a much stronger coupling, which was my point really around requiring refinement of the regulation, so that we require refinement of this definition of healthy, and that it is based on scientific evidence, that industry are given a lead-in period of potentially 2 years to keep up to that. The second point is just around coupling. So I think we haven't necessarily been very good at thinking about regulations that restrict unhealthy foods, HFSS products, alongside requiring this promotion of healthy products. So there's a great scope for that in these placement regulations, sort of the food regulations in the UK, and for Scotland to really embrace that. But also for advertising. Why are we not requiring that 1% or 2% of advertising budgets are spent on minimally processed foods that could take a variety of forms? Now, we'd need to come up with a definition that was a robust legal definition of minimally processed foods, but we could start with, fruit and veg-based products.
You were doing your presentation, you'd mentioned about how few children were actually getting the correct amount of fibre and minerals. When we looked at teenage girls and iron, that was quite a startling kind of piece of information. Yeah, so I think all of those things would be really useful to take into account. Thank you. We've got one question up at the top. And this will be our last question, I'm afraid, for this session.
Hello, I'm Ife Wakano. I'm a champion for the Agri-Food for Net Zero Network and also a director at IntelliDigest. I think my question is as a parent. I've got children and I do my best to try to promote healthy diets to them, but I'm worried about not having additional support from the schools when they go to school, especially where a lot of the children now have access to free school meals and they eat in school, except for those who have dietary requirements. So how can we support the schools, especially the teachers, more to help children, and especially with giving them recognition for their work, giving them fruits and more fruits rather than giving them sweeties to recognize their effort in school? How can we, and also when it comes to desserts in school, you give them a lot of cakes and stuff. How can we reduce that more? Grapes and bananas and more fruits. So it's about how do we support the school so that when you are trying to talk to your child at home, they feel also the school is helping them make the change, because I think it's quite a transition we have to make for our children. Thank you.
So my kind of summing up of that was there were two sort of points there: the access to free school meals within schools, and then also how do we make sure that the school community is supporting the messages that children are getting at home about healthier foodstuffs. Would anybody like to answer that?
Yeah, thank you for that question. Yeah, I think you're right to highlight schools as an important area for children to get the good healthy meal to as part of their daily intake. I think that there's the school that's provided within school as part of meals, as well as the education piece. But I think for me it really highlights the importance of that whole system approach. There's what's in school, there's also what's outside school as children are on their way to school, going out on their lunch break and so on. There's also, making it easier for parents to access those healthier options in shops. So I think for me, it's possibly a bit evasive for your question, but there's just so many things that need to come together to ultimately help change our food environment and make those healthy choices the easier choice. Thanks.
And I think we do know that, don't we? We know that there will be shops in areas where schools are selling and promoting items that are high fat, salt and sugar. And I think it is an issue that we will hopefully be taking into account as we plan policy and we move forward, which should hopefully give parents that bit more support at home as well, with it being a kind of consistent message. Thank you very much, everybody, and thank you to our speakers. Thank you for all your questions, and that's
Hi everyone, just again thanks Michelle for expertly chairing the session and for all the speakers. We're now moving into a short health break which will be 10 minutes where water will be available. Toilets are also back out in the Crush Hall, and if you haven't already done so, please collect a conference bag. You'll find a programme, notepads and pen, and please return promptly in 10 minutes, which will be 11:30. So thank you very much.